I'm Dr. David Cole with Bay Area Heart Center and St. Anthony's Hospital. And I'm going to talk a little bit about coronary artery disease, which is a form of atherosclerosis. Coronary disease, or hardening of the arteries, is a fact of life. We all get it. It is cumulative, and it begins really as soon as we're born. So cholesterol is a necessary chemical in our bodies. We need it to make new cells. But over time, it can lead to deposits on the insides of arteries. It's basically like rust inside a pipe. And when the process gets a little further along as the decades accumulate and we get to middle age, then events can start to occur due to coronary disease. And there's an interesting dynamic about how it happens. A cholesterol plaque will form inside an artery. Typically, it might be soft and inflamed. And it's that soft, inflamed plaque that is more likely to hurt you. What happens is that that plaque will rupture or fissure, and that is a potent stimulus for blood clot formation inside the artery. That's how a person goes from having no symptoms and a moderate narrowing inside one of their arteries to having bad chest pain or a heart attack and winding up in an ambulance or in an emergency room. So what are the symptoms of a heart attack? Only about half of all heart attack victims get any warning pains. So it's important to know what to look for. Classically, the description is a tightness, a heaviness, or a squeezing on the front of the chest. But there are associated symptoms that can be really the predominant symptom, particularly in women. Those are shortness of breath, a feeling of extreme fatigue, lightheadedness, nausea, or a sensation of pounding in the chest. If you begin to experience those, it lasts more than about 2 minutes, then you need to pay attention to it. You need to stop what you're doing. If the pain doesn't resolve immediately, then you need to take an aspirin. If there's a nitroglycerin available, you should put it under your tongue. If the pain is still there 5 minutes later, then you need to seek medical attention immediately, call 911. There's a certain kind of heart attack called a STEMI, where one of the arteries on the heart is completely blocked up. And in that setting, it is a true emergency because time is heart muscle and treatment delayed is treatment denied. It's important to emphasize that the weakest part of that link currently is a patient seeking medical attention. St. Anthony's and other hospitals have finely tuned mechanisms to get these arteries open in less than 90 minutes once a patient has accessed the system. That's an important handoff between the EMS services, the emergency room, and the cardiac cath lab. My partners and I are glad to be associated with St. Anthony's Hospital, which has a long history of patient-centered care in the community, a large concentration of quality doctors, and is really a hospital that's on the upswing.